Over the past decade in Australia, there has been a 20% increase in the number of suicides. And suicide is the leading cause of death for Australians aged 15 to 44. Suicide rates of Aboriginal and Torres Strait Islander people are at least twice that of non-Indigenous Australians. And while women make more suicide attempts, 75% of suicides are by men. It's clear the suicide rates aren't lowering, and we need a new approach. Despite strong community will for action, often suicide prevention efforts are uncoordinated and not based on good evidence of what works, leaving us with a system where people often fall through the gaps. LifeSpan has the potential to turn this around. LifeSpan is a new, evidence-based approach to integrated suicide prevention. It combines 9 strategies that have each been tested and shown to reduce suicidal behaviour into one community-led approach involving health, education, frontline services, business and the community. LifeSpan aims to build a safety net across the community by connecting and coordinating trained people, effective programs, and improving the system of support for people facing a suicide crisis. So how does LifeSpan work? Let's take a look at how it will support a young person, for example. When LifeSpan is implemented, a young person will have increased resilience from proven education programs delivered at their school. If they show signs of distress, training provided to people in the community will increase the likelihood someone notices the warning signs and supports them to seek help. When they visit the doctor, universal screening will help GPs pick up on vulnerability, and if they need specialist help, it will ensure they can find a trained provider. If they need emergency care, police, paramedics and hospital staff will better understand how to manage the crisis, and they will receive coordinated follow-up care that includes their family, school, GP and specialist, so they can recover. Messages in the local media will focus on stories of recovery and how to get help. The community will be involved in local activities to drive change, and access to the means of suicide will be reduced wherever possible to keep people safe. In this way, LifeSpan connects up different parts of the community to create a safety net that improves outcomes at every turn. By using data to identify trends and working together to keep people safe, communities can develop a long-term plan to reduce suicides. We all have a role to play, including looking after ourselves and supporting each other, but it is only by working together that we can prevent suicide. There are many ways that you can contribute, including by doing suicide prevention training and learning about the services and supports in your community so you can help yourself and others. To find out how you can make a difference, please contact your local primary health network or visit www.lifespan.org.au for more information.